What is going on YouTube? It's your daily dose of mental health, and in this video we will be discussing ayahuasca. Before I go any further, if you like the content, please like and subscribe if you can. I'm going to be doing updates and getting some better devices and whatnot in the near future. What I want to start with though is I wanted to hit on a topic, this topic of ayahuasca, because I've gotten questions about it in the past from general people, and I actually have some. I've not personally used it, but I'm wanting to try it at a ceremony. But I know I've got I've got some friends who have tried it before in their past, for various reasons. Now, before anyone jumps to any sort of conclusion saying, look, that's a drug, it's dangerous. Once again, everyone has their own opinion. And before I go any further, I am not a medical doctor. I essentially just give opinions and experiences that I know of were my own experience, but I cannot be giving anyone medical advices or whatnot. I am an RN though, but I just want to share my experience and why I might try this herb, or you can say drug, in the future, for my own mental health. So let's start with, I'm not going to pronounce the names of what ayahuasca is at a molecular level. I just want to kind of give you an idea of what it is. So on Healthline again, so in regarding ayahuasca, you may have heard stories of people traveling to foreign destinations to experience taking ayahuasca. Ayahuasca, which is it's essentially a psychoactive brew. It's been compared to a stronger version of mushrooms or even acid, LSD. And typically it's taken, I'd have to look, but there's a place in Kentucky where they do ayahuasca ceremonies, but it's really a lot of South America, Argentina, Colombia, Brazil. That's where they have a lot of these, where if you really wanted to have one and you left the country, that would be a place to go see if you can get in one. There's typically a shaman involved that helps you lead you through the experience. But okay, so what I'm going to continue to just give a general background. Typically these anecdotes tend to focus on immediate effects that take place during an ayahuasca trip, some of which are enlightening while others downright distressing. So in other words, some people who consume this tea will have a trip which is a very positive one, or a very negative one where they have it. It's kind of like any psychoactive substance, including marijuana, where if you take too much of it, or edibles in particular, where it's very stressful, you can become very paranoid, and sometimes people have been rushed to the emergency room as a result, where essentially what they do there is give you fluids and calm you down. They don't even really give you anything. It's just like they're assuring you you're okay. So once again, I'm not what it is. It's traditionally, as I said, traditionally a shaman or an experienced healer. Now, I don't know exactly what the healer entails in regards to what the qualifications are. So that's a bit, for me, that kind of makes me a little skeptical in regards to it. But they prepare the ceremonies, and they prepare apparently the brew of it, where they boil the torn leaves of the psychoactive substance, and they stock I don't know how to pronounce this, but Banus streptosis vine in the water. So they take the substances, put it in the water, they brew it. And that's what the shaman does. He makes sure it's done the right way to make sure there's no pesticides, molds, or anything in it, to ensure, hopefully, a decent experience, and to ensure the consumers of it during the ceremony that it is not laced or anything. Now, essentially how it works is DMT, a powerful hallucinogenic chemical. It has very low bioavailability, and it gets broken down by enzymes called MAOs in your liver and gastrointestinal tract. Once again, I'll make the comparison because I've had before some other psychoactive substances in my past, including eating marijuana, And one big misconception to a lot of people, like for example with edibles or things, it's when you take it, if you're like compared to smoking, like you can smoke DMT as well apparently. If you're not feeling it instantaneously, then oh, I need to take more and more. A lot of these substances have to be processed, as we said, by your gastrointestinal tract and your liver, which can take time for it to kick in. But it must be combined with an MAO inhibitor. And the reason being is that if you don't have that, you don't get the DMT effect. We naturally have these enzymes, the MAOs. So if, for example, and everyone has those. Everyone has those enzymes. That's just a background on it. So what I want to go to next is, as I said, it's used in ceremonies. It's strongly recommended that it can only be taken by a supervised and experienced shaman. That is key. Also, once again, haven't tried it, but I've had psychedelics in the past. One thing that I've noticed that has ensured for me a good experience is always doing things like this should be done in a safe environment. Now you might be asking, why are you talking about psychedelics and whatnot? I'm going to get to that in a couple minutes. But of course, I can't advise anyone to do it, but in my experience, I've had a couple bad psychoactive trips from like weed edibles and whatnot, and I can assure you that one of the big things for me that made it very negative was the environment. You always want to be in a safe environment wherever you live. Sometimes where some of the worst freakouts and stuff can happen is when you're in an unfamiliar place. So if you're with friends somewhere that you're not familiar with, sometimes you can be more likely to trip and not have a good experience at all and have a freak out and be paranoid. And that's how people sometimes will end up in the ER. And at the psych facility, I've seen it myself, had patients that's happened to. And it can be a burden for a lot of people, family members and whatnot, when that could have been avoided just being in a positive environment. But that is why, in particular, something like ayahuasca, you might be asking, well, if you're going to do it, you can't do it at home. Why would you go to South America or whatnot and do it where it's very prominent? The reason why, first off, I go do it there, it's because of the shamans. I've read a lot of reviews, and doing it there, that's where you tend to have the best results. It's a process where it's not just a day. It's typically like a 2 to 3 day thing, because you have tea, you essentially have a very small amount of tea the first day, and you see how you react, then you build up on it each day a little bit. And countries that do it again, Peru, Costa Rica, Brazil, Argentina, Colombia. But when you're in a different country in particular, you want to make sure you trust the shaman or get to know him or her a little bit before doing the substance. And once again, I'm just giving a little background on the substance before I tell you why I'm even discussing it. It's also recommended that before partaking in the ceremony, and I think it's 12 to 24 hours before, it is highly recommended that you abstain from any other drugs, cigarettes, alcohol, sex as well, and caffeine, so you can get the best effect. It is also suggested that to have a good experience, you follow for a week a vegetarian diet or a vegan diet, actually 2 to 4 weeks prior. So, as I've said, they're typically like 3 days a lot of times, and the reason why, and one last thing, so when consuming, it can be 20 to 60 minutes to kick in, and the trip typically lasts anywhere from 2 to 6 hours. You can smoke DMT as well, but you get a better experience, I've heard, because it doesn't hit you instantaneously. If you smoke it, it hits you instantaneously, and it doesn't last as long. Now, before you do the first dose of it, you're with the shaman. They tell you the possible side effects and symptoms that may occur. It is very common the first time you do it to actually vomit, have diarrhea, feelings of euphoria, and strong visual and auditory hallucinations, mind-altering psychedelic effects, fear, and as I was speaking about earlier with other psychedelics, a big thing is paranoia. And as I said, vomiting and diarrhea are actually considered normal during this cleansing experience. which has to do with getting that negativity in your body out of you, which I'll discuss. So my main thing is why. Now you might ask why. Why did it take you 10 minutes to, why'd you go over that? Where is this going? Because it is strongly advised, and I haven't went completely into my past, but I've been reevaluating, and I'm gonna start journaling, and I've been really thinking lately, what caused me to go through some of these drug experiences and whatnot? What was it besides, obviously, I have a predisposition to becoming a possible drug addict because I have a family history of alcoholism, pill/drug addiction. So I know that, but I wanted to I want to explore further down that line in regards to the idea of not just your nature, but also nature versus nurture, which is talked about in psychology a lot. And what I mean by that is any sort of negative experiences, especially when you're a kid, when your brain is still going through that neuroplasticity. Your brain's always evolving, especially when you're young, up until through adolescence, up until adulthood. For example, males, sometimes their prefrontal cortex, which is the front of their brain, can actually, they've done recent studies that it can be all the way up to age 30 before your brain is fully developed in men. Women, it's typically early 20s. So my point to this, though, is it is very, the reason why I'm interested is because, as I said, down that nurture aspect, I grew up in a good family. Told everyone that. I didn't have any, my parents provided everything for me. I was in a positive environment. I just naturally, as a kid growing up, had a lot more anxiety. I had some separation anxiety issues, especially I remember when I was younger, when I was in, I remember some memories of like, from even like kindergarten up to like 4th grade, where it would be hard for me to even go over to a friend's house, because I would be scared. I'd want my mom and dad there. I had that separation problem, and I literally a lot of times couldn't even establish relationships with friends in that age because I wanted to be with my parents. But there were also some other negative aspects of my life that I went through that I'm not going to completely go into in this video, but I'll just tell you that triggered some PTSD in my life. I've seen, I'll just say this, I've seen some things, and I've been to some places that I was exposed to by friends' parents, and my own at one point. And when it was going on, I didn't really recognize that as an issue, but looking back on it, the nightmares and dreams I had, it caused, I'll just say, PTSD, which I think made my anxiety a little bit worse, which made me not feel normal. And I think that was part of my problem with becoming partially a drug addict. In particular, if you watch some of my videos, if you go through them, it's being a tramadol addict. And as I've said, I'm clean up to this point. I've used things like kratom, ashwagandha, but the reason why I'm so interested is because I've been reading more and more about how when you take this substance, it can be very mind altering and create severe anxiety. So the actual experience is really rough, but when you're in it, you're brought back to these experiences and you get to face them head on. And also, besides ayahuasca, that's what a big thing for, like, why they give patients now in clinical settings, ketamine, which is essentially, I mean, it's a hallucinogenic for people who have depression and PTSD and anxiety, which has been known to have great long-term effects. Now with the ayahuasca, I've got a couple friends who have tried it who have PTSD, severe PTSD. Not exactly the same as me, and I'll make a video over my PTSD in the future. But the thing that I've noticed about them that's been a huge change is before they did it, I mean, I know them, but after they went through this experience, it's almost like you see them and it's like they're the same person, but they just seem like they're fresh and they have a complete restart. Like with me right now, I know I'm clean and I'm doing my best, but I still have those compulsory urges to use, and I have bad days like everyone, And I know I still will after I try this substance, but I want to really try it because I've heard it really does help confront your demons. And after the ceremony, after the 3 to 5 days, long term, I've heard it's almost like a brain reset, to where a lot of your problems you had in your past, your anxiety and whatnot, it's like it's a reset and you have a fresh start again. Um, and because, and as I've said, one of my friends in particular, after has really bad anxiety in particular, and PTSD, and he said ever since that experience, it's like while he was in that experience, he confronted his demons. I'm just saying demons for his PTSD, and afterwards he still acknowledges his past problems, but it's like it gave him a fresh restart. And he's like, after when you're going through it, it's very, very, he just describes it as like literally a mind altering experience in regards to it's when you're doing it. He was like, it's scary. He said he threw up during it, but it's almost like once you're through with it on that third day, you see life for what it is around you, and you're thankful for everything. You see everything through you see everything through such a simplistic mindset in regards to just, you realize he was even saying, like, when he was done with it, how thankful he is just to be able to take your next breath. The thought of just living in the moment, he said, in particularly, like, he can now go, and he said he was doing a public event through his job, and he used to get really anxious, and he would take anxiety meds. He doesn't do that anymore, because he's like, what I've learned is, he's like, once you go through that experience, and this is why I think it's interesting. It's because I always like to think ahead. So most of the time, if I have something I have to do, I'm thinking ahead, like, well, what if when I go do such and such, what if this happens? What if this happens? It's like a domino effect. What if this happens? What if that happens? And then half the time, once you go do whatever it is, all those things you thought of and spent all that mental energy for never even happened. And he said after he took the ayahuasca, he doesn't have those urges anymore. He just completely lives in the moment with it. And that's why I'm interested in it. It's for me something that would optimize my health. And I will say, I have heard for certain people, I would not advise this, and this is me, if I would have never used a psychedelic in the past, that would be a very hard and intense one the first time to use. I'm not giving advice on that, but for me, that's why I just want to go and try this, because I feel like at this point in my life, I'm an adult, and if I have a negative experience and something happens, that is my own decision. That's the glory of free will. You can make your own decisions on things like this. And I think I'm coming to the realization that when this whole COVID thing's over and whatnot, that I want to go try this, and I'm going to start kind of saving up for it, because it's one of those things that would be a great experience to see how it affects me. And I've heard kind of like ibogaine, similar thing, but if that, that would be another route that I want to try, but I want to explore all my options. And once again, don't get the idea that I'm wanting to try to use something and then I'm going to have more issues and become an addict again or whatnot. That's not it. It's the idea that, as I've said from the beginning of this channel, whatever helps you in a positive way that helps you contribute to society and helps you live a more fulfilling life, I'm for. As I've said, if you were using meth for years because you had ADD or whatnot, and then you get prescribed Adderall, even, for example, and you are contributing, and that is what is helping you in life, or whatever it is. There are people out there who do live in chronic pain, who swear by, they take their dose of their opioid and they don't have any problem with it, and that's what gets them through the day. And I've got no problems with that, but at the same time, I want to be able to explore what my weaknesses are and further myself as becoming a better person. And this is why I'm so interested in ayahuasca in particular. That's it for this video tonight. Once again, please, if you like this channel, like and subscribe if you want to. Also, and it should be like in that right hand corner down there, just all you do is click it, and honestly put your comments. Let me know if you've ever tried something like this, and if you're opposed to it as well, put something in the comments. I'm completely cool with that. I want to hear everyone's opinions on it. Let's just keep it to a very, if you have a differing point of view than me, go ahead and put it down there, but I don't want to start fights or anything in it. This is all to better each other, to expand our knowledge of ourselves, and hopefully become better humans. That is today's daily dose of mental health message. Let's have a great weekend. I love you all. In the next video, I'll do it probably in the next sometime next week, because I'm gonna be really busy. I'm working on, once again, getting back into the job force with a new RN job, which I'll keep you updated on that as well. Love you all. Put a comment down there. That is it. Peace out, y'all.